All right. It is important to have balance, right? Balance training is a huge component of an exercise program, again, in trying to optimize performance, improve injury resistance, and enhance our rehabilitation. The support and the foundation of why we're going to include balance training is that, there are probably 80% of your clients, or 80% of adults at some point, are going to have low back pain. And we have a plethora, right? Just an abnormal, like outstanding amount of like ACL injuries and ankle sprains, things that could be prevented and avoided if we have done the appropriate training in this area. So maintaining the balance involves the ability of an individual to control the position of the center of gravity over the base of support. So, right, the wider the base of support, the more stable the base of support, the more likely it is that I'm going to be able to maintain my balance. If I'm doing some work on some unstable surfaces, that's going to help in some different ways than if I'm, being like static on a hard, flat surface, and then being challenged in other ways to move my body and control my body. So there's pros and cons to you being on, stable surfaces versus unstable surfaces, but, they both have their place. Types of balance include static, semi-dynamic, and dynamic. Right, so static, right, we're the stationary body position. We're just working on some balance in a stationary position. Could be as simple as like just standing on one leg. Semi-dynamic, right, the base supporting the body is in movement. That could be standing on one leg, but standing on a Dynadisc or on a foam pad. Right, the base supporting the body is in movement, and then more dynamic could be that we're standing on a wobble board. A slack line, something that's like truly given us a changing base of support. And these can be manipulated to change the level of difficulty during a balanced training program. But again, right, take your steps, take your appropriate steps and progressions to get to that point. Don't just throw somebody right into the fire. Right? The balance mechanism involves three key senses. Right, so we use our vision to give ourselves some feedback. Our vestibular senses, which are our inner ear kind of senses, and somatosensation, right? So somatosensation is just our ability to feel the changes in pressure in the skin, in the muscle length, the joint angles. This is where some of your pieces come into play, like your Golgi tendon organs, your muscle spindle fibers that are going to give some more feedback on the joints and the length and tension in the muscles. But they all play a part. Right, that's why something as simple as taking away a piece of the puzzle, taking away the vision. If I have you close one eye or close both eyes, your balance becomes much more challenging. Sometimes, right, if we think about times that we've had ear aches, ear infections, if you have any kind of like a sinus infection where there's increased pressure in your brain and in your inner ear, that can have an impact. So we think about balance training. It's been shown to improve performance and reduce injury rates in athletes when it's been incorporated into a comprehensive injury prevention program that is carried throughout the course of an athletic season. So simple little things, doing some of these practice pieces, it doesn't have to be a lot, but if you're using it in season, just enough that, your regular gameplay is not diminishing because you're just ignoring this piece of the puzzle. Strong evidence demonstrates that balance training programs can reduce the risk of falls in healthy older adults, right? It makes sense. Fitness professionals should always emphasize safety when designing a progressive balance training program, especially for clients with a history of injuries or a current injury. So again, like we said, be smart about what piece you are applying, where you're progressing or regressing someone's training. If you're working with someone and saying, that they're going to be working on their balance and they've just come off an ankle sprain, I'm probably going to do some more work in this static position before I really think about having them do something more dynamic where they're like jumping and hopping and landing to a position. Just be smart about where you're progressing them and what you're putting into the program. When developing the balance training program, you also want to emphasize a safe and progressive increase in proprioceptive demand based on the client's performance. Same thing we just said. We want to make sure that people have mastery of the first level before they really are challenged and move into the next step of the process. Many variables can be manipulated when designing the balance training program, and This makes sense, right? We can change the plane of motion that we're balancing and moving in. We can change the full range that someone's working in. If I have someone stand on a single leg and do, it could be just the single leg. It could be, okay, now we're going to try to do a single leg squat and touch down. It could be doing a full pistol squat, right? That's maybe a little bit of an advanced version, but we can change the range of motion. We can also change the speed. And we can change the proprioceptive environment. Proprioceptive environment, like I said, that could be, closing an eye. That could be giving them, having them wear shoes versus having them shoes off. And you just want to be cautious that you're not changing too many variables at one time when you're progressing things. So, like I said, so that they can develop appropriate mastery at each stage.